The Pittsburgh Health Corps is a program of the National Health Corps AmeriCorps program. Since 1994, the Pittsburgh Health Corps has been based in the Allegheny County Health Department, which fosters collaboration between members and agencies throughout the Pittsburgh area. The Pittsburgh Health Corps is committed to decreasing disparities in local health care delivery systems and promoting health. The Pittsburgh Health Corps collaborates with a broad range of sites to ensure members are exposed to diverse opportunities in public health. Sites typically include homeless clinics, schools, healthcare centers, and intergenerational community programs. Site supervisors serve as mentors to their members and model professionalism and commitment to service and the community. Pittsburgh Health Corps members commit to 1,700 hours of service over 46 weeks as outlined in the detailed service descriptions of each site. They are also required to attend monthly member trainings and service projects, become involved in community activities, and connect with other local corps. A year of service in the Pittsburgh Health Corps helps members to gain a better understanding of at-risk populations and the challenges and rewards of service to communities. The staff of the Pittsburgh Health Corps respects the dedication and service of its members by providing the best AmeriCorps experience possible, while the members are either considering or preparing for a career in a health-related field. Hopefully, this ensures that members have a life-changing experience as they are serving others, both during their year of service and beyond.
My name's Sara Mae, and initially I joined the Pittsburgh Health Corps to gain experience in the field of public health and to narrow down my career interests. Serving with primary care health services has allowed me to do this by putting me in contact with a wide variety of healthcare professionals, from doctors and nurses to social workers and health educators. But more importantly, I've had an amazing site mentor. She's encouraged me to explore my own interests by giving me the freedom to define my role at the organization and pursue the projects about which I'm most passionate. Because I get to be involved in a variety of tasks at my site, I've learned that I most enjoy working directly with our patients, listening to their stories, linking them with services, and following up to find out how they're doing. From my experiences, I've decided to pursue my master's in social work so that I can continue serving those in need. My year of service has taught me so much, but the best part has been meeting so many amazing and passionate people who are committed to serving their community every day. I've been inspired by these compassionate individuals as well as the people who I've had the privilege to serve. I think that most AmeriCorps members start out with a sense of idealism and optimism about how we can change the world. And I feel fortunate that I've maintained both my idealism and my optimism in the face of saddening situations. This has only been possible because I have witnessed the incredible good that my agency and the other Health Corps members are able to provide to so many people.
My name is Debra Robinson, and I'm the supervisor at Primary Care Health Services, and responsible for our Behavioral Health and Social Services department. A big part of what my department does is outreach, and having an AmeriCorps member really has enabled our agency to devote energy to innovative ways, not only to retain patients, but really to work on how to solicit feedback from residents and how we provide care. I think this is really one of those things that most healthcare providers have on their wish list, that but just have difficulty kind of carving out a space to allocate resources to such a worthy project. Members really do, they bring a whole network of resources with them through the AmeriCorps program. This represents additional resources, ideas, and opportunities for partner agencies. Working with a Pittsburgh Health Corps member gives me the luxury of staying connected to the theories behind what I do, really the philosophy of being a social worker in a community health center setting. It's so very easy to get caught up in the day-to-day task of my job and you sometimes start focusing on the outcomes, on the numbers. As a manager, I have time cards and reports and staff evaluations, committees, and meetings that I'm running around to, and you can really so easily get consumed by those tasks. And having an AmeriCorps member really helps me to stay focused on the process, on the families that I work with, And just to keep me focused on why I became a social worker, I truly believe that I'm a better worker because of the relationship with my AmeriCorps member.
Pittsburgh Health Corps has given me insight into the logistics of public health outreach. I knew I wanted to pursue a career in public service and nonprofit organizations, but after realizing that we are experiencing health disparities like sleep-related infant deaths in the United States, I found a real interest in pursuing a career in international development, specifically addressing maternal and child health issues. I considered the challenges to develop similar initiatives to combat problems like these in countries without the resources. It's my hope that I can use what I've learned here to lead an organization to help mothers and children around the world. As a Pittsburgh Health Corps member serving with the Infant Safe Sleep Church and Community Outreach Committee, I've learned so much about public health. I've had the opportunity to speak with large groups, educate patients, conduct trainings, and facilitate presentations about SIDS and infant safe sleep, and collaborated with community members to come up with new and creative ways to share health information. As a result of my experience, I've really had the opportunity to learn and strengthen important skills like public speaking. Also, I realized that community buy-in and ownership of the public health issue is an essential component to improving health outcomes.
Hello, my name is Matthew Boulton, Nutrition Supervisor at the Greater Pittsburgh Community Food Bank. The Pittsburgh Health Corps helps us keep alive our direct outreach programming that otherwise would not be done. Our children's nutrition education is 100% sustained by AmeriCorps. Without its members, our children would not receive valuable hands-on nutrition education and healthy cooking tips. Having a Pittsburgh Health Corps member also gives us the opportunity to give up-and-coming leaders of tomorrow a first-hand look at social challenges we face in the community.